All right, welcome back to ABA exam review and the continuation of our RBT practice question series, where we're going through the next set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack. When you pass your exam, please let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Dr. Gina is reviewing standards with her class regarding how to graph data appropriately. Dr. Gina asks, now, what standard of the four are we talking about with this data point? And then motions towards the second standard. Motioning towards the second standard could be considered what? All right, so the question is asking about the motion towards the second standard. And so this is going to be a prompting question. And how do we know that? Well, the typical order for prompting, we have our SD, we have our prompt, and then we have our response. And so when you have a prompting question, you always want to look at what happens directly after the SD. And in this case, our SD is what? Well, Dr. Jean is reviewing standards on how to graph. She asks, now what standard of the four are we talking about with this data point? That is the SD. And then immediately motions towards the second standard. So our prompt is this motioning towards the second standard. However, the class reacts will be our response. But we are worried about the prompt and what type of prompt it is. So a physical prompt. Did Dr. Gina physically prompt any of her students? No, a physical prompt is exactly what it sounds like. Some sort of physical interaction between you and the learner where you're helping and guiding them through the correct answer. Dr. Gina did not use any physical prompts. What she did was she made a gesture, right? She simply motioned towards the second standard. She might have pointed, she might have hand waved, just made some sort of motion towards the right standard or at least the second standard. What about a positional prompt? A positional prompt C, that is when you manipulate the stimulus in question. If she had moved the second standard to a different location or manipulated it in some way, it might have been a positional prompt, but she didn't. She made a gesture. And then a modeling prompt. A modeling prompt is when you, the teacher, engage and demonstrate the correct behavior. Dr. Gina didn't necessarily do that. She simply made a motion towards the second standard. She gestured towards the answer she wanted. Her prompt was a gestural prompt. So motioning towards the second standard could be considered a gestural prompt. You taught your two cousins a handshake at the Easter family get together. 3 months later, you visited your cousins again, and they immediately do the handshake with you. What is most represented here? All right, pretty straightforward question. We're looking for what is represented by the question. If you get a question like what is most represented, what does this represent? It's simply asking what term are we looking at here? What term are we thinking about given the context of the question? And the context is you taught your cousins a handshake at the Easter family get together. So you've taught them this skill. 3 months go by, you visit again, and they immediately do the handshake with you. Now, when you're thinking about generalization and maintenance and these ideas, maintenance has a teaching component, it has a break in teaching where its teaching stops, and then it has a demonstration of the skill that was taught. Meaning you teach the skill, teaching stops, and then the skill continues. In this case, you taught your cousins the handshake. 3 months go by, you visit again, and they do the handshake with you. So it seems we have all those components. So what is represented? A, response generalization. Response generalization says more than one response occurs in the presence of a single stimulus. Typically, these new responses are untaught. So we don't have really response generalization here. We have a single response, right? You taught the handshake. That's the response we're concerned with. So we don't have response generalization. What about shaping? Well, did we reinforce any approximations of behavior? No, we don't know how you taught the handshake. We just know you taught the handshake. What about overgeneralization? Has the handshake occurred too much, too often, at inappropriate times? No, you taught them the handshake at Easter. 3 months later, you visit again, and they're doing the handshake with you. So it doesn't seem to be overgeneralized. What looks to be represented seems to be maintenance. Again, maintenance occurs once teaching has happened, and then teaching stops, and then the skill can still be done. We call that maintaining the skill or maintenance of the skill. There's a reason we run maintenance drills to make sure skills are persistent. Your supervisor asked you, a behavior technician, to start working with the client with extreme behavior. The client also has a bipolar diagnosis and has threatened to commit suicide in the past. You have not worked with any clients with this diagnosis or specific past. As the behavior technician, what can you do? All right, tricky question here because you are the behavior technician and you're being told or asked to work with a certain client. And we want to make sure that we're competent for all the individuals we work with. Now, if you're competent in ABA, you're very likely competent with children with autism or adults with autism. That's where most of ABA professionals work. In this case, however, you're the behavior technician and the client also has bipolar diagnosis and has threatened to commit suicide. So they're bipolar and they're suicidal. You've never worked with clients with this diagnosis or past. Now, why might that be an issue? Well, being bipolar and being suicidal are two very different things than what apparently you, this behavior technician, are normally used to working with. And so, what can you do as a technician in this situation where maybe you don't feel comfortable with this particular client, or maybe you do? A, accept the case and request further training from your behavior analyst. Sure, as long as you're receiving training and supervision for this particular type of client, that's totally fine. If you're not competent or if you're not comfortable, you can't accept the case unless you're getting further training and supervision. So A seems okay. What about B? Decline the case due to a lack of competence in this area. You can also do that. You're free to decline cases that you don't feel you have the competence to pull off. That is totally within the realm of your rights as a behavior technician. If you don't feel you can handle or work with bipolar and suicidal clients because you have no experience, you can decline that case. Now, what about C? You do not have a choice as a behavior technician to accept this case or not. Now, that's not necessarily true because there are extenuating factors like diagnosis and the suicidal past that give you the right as a technician. Now, does that mean that you have the right to reject any case and pick and choose your cases? No, because there are competencies you gain working as a technician. And most of you will be working with people with autism, and so you're going to gain a competence with autism. The difference here is the extra diagnosis and the addition of this suicidal past. That gives you more of a right to say, well, I'm not comfortable, I'm not competent. So as a behavior technician, what can you do? Well, you can accept the case and request further training, or you can decline the case due to a lack of competence. So the answer is D, both A and B. Remember, we are trying to provide the best services at all times to our clients. We're also trying to do no harm. Those are our goals. Emmanuel takes a Flintstones vitamin each morning as soon as he wakes up. Emmanuel says the vitamin makes him feel good as soon as he takes the vitamin. Emmanuel's behavior is under the influence of what? All right, consequence question. We always like to ask consequence questions because they always come up and they are the foundation for everything else we do. So we're looking at Emmanuel's behavior. Consequence questions always focus on whose behavior. We're looking at Emmanuel's behavior. What is Emmanuel doing? Well, he's taking a Flintstone vitamin each morning. Emmanuel says when he takes the vitamin, it makes him feel good. Now, is that subjective? It might be, but what has happened to Emmanuel's behavior as a result of this consequence of feeling good? Well, he's still taking the vitamin. He takes the vitamin every single morning. And so he takes the vitamin, it quote unquote makes him feel good, and he continues to take the vitamin. Well, what's happened to Emmanuel's behavior? Well, it's been A, positively reinforced. And how do we get there? How do we get there so quick? Now, if you're new to studying, okay, you need to slow down on consequence questions and break them down. First, ask yourself, how did future behavior change? Did behavior increase or decrease? If it increased or maintained, as in this case where he's still taking the vitamins, we're looking at reinforcement. If it decreased, we're looking at punishment or extinction. Emmanuel continues to take the vitamins, so he's being reinforced. Now, Positive or negative refers to the consequence. Was that consequence an addition or a subtraction or taken away? Well, in this case, the feeling of good, as a manual puts it, was added. So it was positive. So you put those two together, you get positive reinforcement. The negative reinforcement, it is reinforcement, but the consequence isn't taking away, right? It's adding the feeling of good. So it's not negative. And then, of course, C and D both have to do with punishment. The behavior did not decrease, it can't be punishment. And that's how we need to break down consequence questions. How does the behavior change? Does it increase or decrease? And then was the consequence added or removed? In this case, Emmanuel's behavior is under the influence of A, positive reinforcement. If you were to implement an intervention with the goal of improving your client's ability to engage in conversations with others, what type of variability would you want to see from your graphed data? All right, graphing questions, pretty straightforward. You're typically dealing with line graphs, and you want to know a couple things, including trends and variabilities. Trends, and when we talk about the trend of data, it's the way the data is moving. Is the trend increasing? Is it decreasing? When we talk about variability, we talk about how much is the behavior changing point to point. So if I have a graph and I have data points here, 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 that's a lot of variability because you can see the topmost here and the bottommost here. It's a wide range. If you have a different graph and the data points look like this, that's not very variable, right? Because your topmost is here to here. That's a big difference. That's what we mean when we say variability. So, if your goal is to improve your client's ability to engage in conversation, would you want a lot of variability or a little? Well, of course, you'd want a low variability because you'd want to see a constant improvement in the data. If you're improving one day and then the next day it's back to where it was and the next day it's back up again, it's not what you want to see. You want low variability from your graph data. You don't want moderate variability or high variability. Variability is typically not going to be a good thing, especially if you're intervening already, because we want to see our intervention making progress with the skill. If the behavior is jumping all over the place, there might be a different issue at hand. If you're trying to improve something or even decrease something, what type of variability do you want to see? Well, you want to see low variability. All right. Thank you so much for watching. Check out btexamreview.com for all of our study materials. The link is in the comments below. Subscribe if you have not already. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.